This is the book of Davidson. ഞാൻ ആരാന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ ഞാനൊരു MBBS ഗ്രാജുവേറ്റ് ആണ്. 2020 തമിഴ്നാട്ടിൽ നിന്ന് തമിഴ്നാട് ഗവൺമെൻറ്റിൽ നിന്ന് പാസ് ഔട്ടായ ഒരു MBBS ഗ്രാജുവേറ്റ് ആണ്. കഴിഞ്ഞ 3-4 വർഷക്കാലം ഞാൻ എന്ത് ചെയ്തു എന്ന് പറഞ്ഞാൽ, ഞാൻ 2 ഹോസ്പിറ്റലിൽ വർക്ക് ചെയ്തു. അത് കഴിഞ്ഞ് ഞാൻ പിന്നെ അതിൻ്റെ നടുക്ക് കുറേ ഗ്യാപ്പ് ഉണ്ടായിരുന്നു. എനിക്ക് ശരിക്കൊന്നും പഠിക്കാൻ പറ്റില്ല, കുറേ പ്രശ്നങ്ങൾ കാരണം. ഇനി ഞാൻ ഒന്നുകൂടെയും എല്ലാം പുതിയതായിട്ട് പഠിക്കാൻ പോവുകയാണ്. അപ്പോൾ നിങ്ങളും എൻ്റെ കൂടെ ജോയിൻ ചെയ്യുമെന്ന് ഞാൻ വിശ്വസിക്കുന്നു. എനിക്കിപ്പം എൻ്റെ ഏറ്റവും വലിയ ആഗ്രഹം ഈ ന്യൂ ഇയറിൽ എന്താണെന്ന് വെച്ചാൽ, എനിക്കൊരു നല്ല ഡോക്ടർ ആവണമെന്നുള്ളതാണ് ആഗ്രഹം. ഞാൻ ഡോക്ടറായി കഴിഞ്ഞു എന്ന് എനിക്കറിയാം, പക്ഷേ എന്നിരുന്നാലും ഞാൻ നല്ലൊരു ഡോക്ടർ ആയില്ല എന്ന് എനിക്ക് വിശ്വാസമുണ്ട്. കാരണം അതിലെനിക്കൊരു തൃപ്തിയില്ല. അതുകൊണ്ട് ഞാനൊരു നല്ല ഡോക്ടർ ആവണമെന്ന് കരുതി ഞാൻ പഠിക്കാനിരിക്കുകയാണ്. നിങ്ങളെല്ലാവരും എൻ്റെ ഒപ്പം ചേരുമെന്ന് ഞാൻ വിശ്വസിച്ചുകൊണ്ട് ഞാൻ ഇതിന് ഇൻട്രൊഡക്ഷൻ നോക്കുകയാണ്. ഇൻട്രൊഡക്ഷൻ തൊട്ടേ നോക്കുന്നതിന് കാരണം, ഒരു നല്ല ഡോക്ടർ ആവണമെങ്കിൽ നമ്മൾ ബിഗിനിങ് തൊട്ടേ പഠിക്കണം, എല്ലാം തന്നെ പഠിച്ചിരിക്കണം. ഇപ്പോൾ സ്റ്റാർട്ടിങ്ങിൽ പറയുന്നത് ഡോക്ടർ പേഷ്യൻ്റ് റിലേഷൻഷിപ്പും കാര്യങ്ങളും ഒക്കെയാണ്. അതൊക്കെ തന്നെ നോക്കി പോകണം തന്നെയാണ്. കാരണം ഞാൻ പണ്ടൊന്നും പഠിക്കുന്ന കാലത്ത് ഇതൊന്നും നോക്കാതെ ആയിരുന്നു പഠിച്ചുകൊണ്ടിരുന്നത്. ഇനിയിപ്പം എല്ലാം നോക്കി തന്നെ ഞാൻ പോവുകയാണ്. അപ്പോൾ ശരി, ഞാനിപ്പം ആദ്യത്തെ ചാപ്റ്റർ വായിക്കുകയാണ്. ഇതിപ്പോൾ ഇൻട്രൊഡക്ഷൻ ആയതുകൊണ്ട് അധികം എല്ലാവർക്കും വേണമെന്ന് തോന്നുന്നില്ല. ഞാൻ വായിച്ചു കഴിഞ്ഞിട്ട് ഇതിൻ്റെ അകത്ത് മെയിനായിട്ടുള്ള കാര്യങ്ങൾ പറയാം. The first section of the book, Principles of Medicine, describes the basis on which medicine is practiced and the fundamental mechanisms determining health and disease which are relevant to all medical specialties. The second section, Practice of Medicine, is devoted to individual medical specialties. Each chapter has been written by experts in the field to provide the level of detail expected of trainees in their discipline. To maintain the book's virtue of being concise, care has been taken to avoid unnecessary duplication between chapters. The system-based chapters follow a standard format, beginning with an overview of relevant clinical examination, followed by an account of functional anatomy, physiology, and investigations, then the common presentations of disease and details of individual diseases and treatments of that system. Where appropriate, the chapters in the first section follow a similar format in the chapters which describe the immunological, cellular, and molecular base of disease. This problem-based approach brings the close links between modern medical science and clinical practice into sharp focus. The methods used to present information are described below. Clinical examination overviews, presenting problems, boxes, general information, practice. Clinical examination overviews, presenting problems. The value, ഇതിപ്പം നമുക്ക് മനസ്സിലാക്കാവുന്നതേ ഉള്ളൂ, വലിയ ഇമ്പോർട്ടൻസ് കൊടുക്കേണ്ട ആവശ്യമില്ല, ജസ്റ്റ് അറിഞ്ഞു പോവുക അത്രേ ഉള്ളൂ. Clinical examination overviews. The value of good clinical skills is highlighted by a two-page overview of the important elements of the clinical examination at the beginning of most chapters. The left-hand page includes the mannequin to illustrate key steps in examination of the relevant system, beginning with simple observations and progressing in a logical sequence around the body. The right-hand page expands on selected themes and includes tips on examination techniques and interpretation of physical science. These overviews are intended to act as an aid memoir and not as a replacement for a detailed text on clinical examination as provided in the sister title, MacLeod's Clinical Examination. Presenting problems. Medical students and junior doctors must not only learn a great many facts about various disorders, but also develop an analytical approach to formulating a differential diagnosis and a plan of investigation for patients who present with particular symptoms or signs. In Davidson's, this is addressed by incorporating a presenting problems section into all system-based chapters. Nearly 300 presentations are included, which represent the most common reasons for a referral to each medical specialty. The same approach has been used in several of the chapters in the Principles of Medicine session to reinforce the close connection between the clinical problems and fundamental mechanisms of disease. Many patients present with symptoms such as weight loss, dizziness, or breathlessness which are not specific to a particular system. These are described in the most relevant chapters and cross-referenced elsewhere. A list of presenting problems may be found on pages 7 to 8. Boxes. Boxes are a popular way of presenting information and are particularly useful for revision. They are classified by the type of information they contain using specific symbols. General information. These includes causes, clinical features, investigations, treatments and other useful information. Evidence-based medicine, EBM. The clinicians base their evidence-based medicine, EBM. Clinicians base their practice on the best available evidence, which needs to be up to date, relevant, authoritative, and easily accessible. Over 120 evidence-based medicine (EBM) boxes are included in this edition. They contain recommendations that are supported by evidence contained from meta-analysis of several randomized controlled trials, or one or more high-quality randomized controlled trials, and therefore to conform to grade A criteria as described in Chapter 1, page 8. Practice point. There are many practical skills that students and doctors must learn. These vary from inserting a nasogastric tube to reading an ECG or X-ray or interpreting investigations such as arterial blood gases or thyroid function tests. Practice point boxes provide straightforward guidance on how these and many other skills can be acquired and applied. Emergency. These boxes describe management of many of the most common emergencies in medicine. Old age. In most developed countries, older people comprise 20% of the population and are the chief users of healthcare. While they contract the same diseases as those who are younger, there are often differences in the way they present and how they are best managed. Chapter 7, Aging and Disease, concentrate on the principles of managing the frailest group who suffer from multiple comorbidity and disability and who tend to present with non-specific problems such as falls or delirium. However, many older people also suffer from specific single organ pathology. In the old age boxes are thus included in each chapter and describe common presentations, implications of physiological changes of aging, effects of age on investigations, problems of treatment in old age, and the benefits and risks of intervention in older people. In pregnancy, many conditions are different in the context of pregnancy. While some arise only during or shortly after pregnancy, particular care must be taken with investigations, for example, to avoid radiation exposure to the fetus and treatment to avoid the use of drugs which harm the fetus. These issues are highlighted by in-pregnancy boxes distributed throughout the book. In adolescents, although the pediatric medicine is not covered in Davidson's, many chronic disorders begin in childhood, and adult physicians often contribute to multidisciplinary teams that manage young patients in transition between pediatric and adult health care services. This group of patients often presents a particular challenge due to the physiological and psychological changes that occur in adolescence and which can have a major impact on the disease and its management. Adolescents can be encouraged to take over responsibility from their parents or carers in managing their disease, but are naturally rebellious and often struggle to adhere to the impositions of chronic treatment. To highlight these issues, we have introduced this new book format in 22nd edition. Terminology. Recommended international non-proprietary names RINNS are used for all drugs with the exception of adrenaline and noradrenaline. However, British spellings have been retained for drug classes and groups. Example, amphetamines, not amphetamines. Units of measurement. The International System of Units, SI units, is recommended means of presentation for laboratory data and has been used throughout Davidson's. However, we recognize that many laboratories around the world continue to provide data in non-SI units, so these have been included in the text for the commonly measured analytes. Both SI and non-SI units are also given in Chapter 29, which describes the reference ranges used in Edinburgh's laboratories. It should be appreciated that these reference ranges may vary from those used in other laboratories. Finding what you are looking for. A contents list is given on the opening page of each chapter. In addition, the book contains numerous cross-references to help readers find their way around, along with the extensive index of over 15,000 subject entries. On the online text available on the Student Consult, www.studentconsult.com allows for detailed sources of content by keyword. A list of up-to-date reviews and useful websites with the links to management guidelines appears at the end of each chapter. Thank you. That's all about the introduction.